about the muscles today is they're all on the posterior side of the leg. They all do the same thing, which is plantar flexion, right? Plantar flexion, remember, is pointing that foot away. So if I want to stretch the calf, any of the plantar flexors, I'm going to go into dorsiflexion, push that heel up, right? That's going to lengthen that tissue out. Does that make sense? So like when you do a calf stretch, put your foot on the edge of something, you kind of lean into it. So that's how we're going to lengthen this tissue. Now when we work the back side of the leg, the posterior leg, I can work gastroc doing this. I can work through gastroc to affect soleus because, again, it's also a plantar flexor. And then same thing even for tibialis posterior. Obviously, tibialis posterior is much deeper, so my effect on that is going to be a little limited. I've got a lot of tissue to try to get through. But basically, I'm going to start him in plantar flexion, so this tissue shortened a little bit, and then I'm going to move him into dorsiflexion just by pressing his forefoot down. And that's going to start to tension this tissue. It's going to start to lengthen it out. You can see it starting to lift a little bit because I'm tensioning it. It's got a little more push, or a little more density to it now. Whereas when it's shortened, it's a little more soft, supple. That should be. So when I do my pin and stretch, I can do this as an effleurage. I'm just going to start in that plantar flex position. And then as I effleurage, I can go the whole backside of the leg. I'm just pushing his foot up into that dorsiflexion, so all this tissue starts to lengthen out. And then I can get more specific if I feel a little density somewhere, maybe a little knot in the calf or something. I can just lay my thumb into it and then push that foot into dorsiflexion. Right? I can do the same thing with soleus down here. So I know that gastroc, the muscle tissue of gastroc kind of ends. And then down here, I've got a little more soleus that I can access. I can do that with a little bit more of like a pincer grip. So I'm going to go around the Achilles tendon and pinch underneath it. I'm just off the fibular bone here. So I'm not on the bone. I'm just off to the backside of it. But then I'm going to do the same thing. I'm just going to push that foot into dorsiflexion to try to lengthen that tissue out. And now sometimes if you get kind of the calves worked through a little bit, you can start to get a little deeper. You'll push off the side of the fibular bone. And so now I'm trying to access underneath gastroc and soleus to try to get to that tibialis posterior. So there are some deep tissue techniques that you can kind of use to maneuver around some muscles, try to get to some deeper structures. Are you still probably hitting a little bit of gastroc and soleus? Yes, absolutely. Right? You're not going to completely slide a muscle over to the side and get up underneath it. But you can at least change your angle a little bit to kind of work through some of the thinner layers where there's a little bit less of that tissue, so we can get to the deeper layers like tibialis posterior or flexor hallucis. I'm probably more on flexor hallucis here, but so super easy. You're just taking that foot, going like that. You will probably want your leg on the table just so that foot's free to move. It's kind of the easiest way to do it. There's some other ways though. You can always bend the leg completely. I've seen people use kind of the heel and their forearm, and they go through it like that, and they can just do a stroke or do a pin, right? So there's other variations. I like the leg on the table because I'm lazy. So let's try that.